6:15 in the morning. Before the coffee, before breakfast, before the day has asked anything of you yet, you fill a mug with warm water, squeeze half a lemon into it, and drink it the way you have every morning for the last several months. Because somewhere along the way, you read that this was one of the healthiest things you could do for your body first thing in the morning. You believe it is detoxing your liver. You believe it is alkalizing your blood. You believe your immune system is getting a head start before the rest of the world wakes up. Some of what you believe is true. Some of it is not happening in any way that science can currently measure. And one thing that is quietly happening to your body every single morning is something almost nobody who drinks lemon water every day has ever been told. My name is Dr. Miles Ebek. I have spent the last 13 years working emergency medicine, and warm lemon water comes up in my department more than you would expect, not as a treatment, but as a conversation. Patients mention it when they list their morning routine. Patients with kidney stones mention it because I ask. And patients with a particular kind of dental damage mention it when I ask them about their diet. And the look on their face when I connect their morning habit to what I am seeing is the same look every time. Nobody told me that part. This video is the part nobody told you. Before we go further, the honest version of what this habit actually does, backed by what I can actually tell you from both the clinical literature and 13 years of watching bodies respond to what people put in them every day, is precisely the kind of thing this channel was built to give you. Subscribe right now, because this is what every video here looks like. Not what sounds good, but what is actually true. Here's what happens in the first 2 minutes. Warm liquid enters your stomach, and the warmth itself matters in a way cold water does not. Your stomach responds to warm liquid by increasing gastric motility, the rhythmic muscular movement that mixes and moves food and fluid through your digestive tract. This is why a warm drink first thing in the morning can produce a reliable urge to have a bowel movement for many people, not because lemon is doing anything specific, but because warm liquid is a gentle, mechanical stimulus to a digestive system that has been still for 8 hours. The lemon adds a mild acidity that can stimulate gastric acid production, which primes your stomach for digestion before you've eaten anything. Neither of these effects is dramatic. Both of them are real, and both of them are driven more by the temperature of the water than by the lemon itself. The hydration piece starts here too, and it deserves a more honest framing than it usually gets. Warm water is not meaningfully better at hydrating you than room temperature water. Both absorb at roughly the same rate. What warm lemon water does is reliably get people to drink a full glass of something first thing in the morning, before caffeine, before food, and before the day starts pulling their attention elsewhere. After 6 to 8 hours without fluid, that first glass matters, and the ritual of the warm lemon water is often the mechanism that makes it happen consistently. The benefit is real. It is just less exotic than most people assume. By minutes 2 to 5, something more specific is underway. And this is the part of the conversation I actually have with patients in my department. Lemons contain citric acid, and when citric acid is absorbed, it raises the urinary citrate level in your kidneys. Citrate is one of the most important natural inhibitors of kidney stone formation. It binds to calcium in the urine before that calcium can crystallize into a stone, and it makes the urine environment less hospitable to the crystals that cause the most common type of kidney stone. This is not a wellness claim. It is a mechanism with clinical support, and lemon juice is actually referenced in nephrology guidelines as a dietary intervention for people with a history of calcium oxalate kidney stones. Marcus was 44 when I first saw him, his third kidney stone in 6 years, the kind of patient who knows the moment it starts because the first time is unforgettable. He asked me what he could actually do at home, not supplements, not expensive interventions, just something real and daily. I told him about the citrate connection and suggested half a lemon in warm water every morning. He looked at me the way people look when they expected something more complicated. 2 years later, I saw him again for an unrelated reason, and he mentioned, almost as an aside, that he had not had a stone since. One habit, one mechanism, 2 years without what he had described as the worst pain of his life. I am not telling you warm lemon water cures kidney stones. I am telling you the citrate mechanism is real, it is supported by evidence, and Marcus's mornings are better for knowing about it. Tell me in the comments how long you have been drinking warm lemon water and why you started, because the answer almost always reveals which part of this conversation is most relevant to you. I read every comment, and your answer shapes what I go deeper on next. Every video here is built around what I actually see in clinical practice and what I actually know from the evidence, not what sounds compelling at 6 in the morning. Subscribe if that is the channel you have been looking for. By minutes 5 to 10, you will have heard that lemon water alkalizes your body. And I want to address this directly because it comes up constantly, and the truth is more interesting than either the claim or the dismissal. Lemons are acidic. The juice has a pH of around 2, which is quite acidic. Your blood maintains a pH between 7.3 to 5 and 7.4 to 5 with remarkable precision, and it does not change based on what you drink. Your kidneys and lungs regulate blood pH so tightly that if it moved even a fraction of a point in either direction, you would be in a medical emergency requiring immediate intervention, not a morning ritual. Drinking lemon water does not change your blood pH. That part of the claim is not accurate. But here is the more interesting truth. Citric acid, once metabolized by your body, produces bicarbonate as a byproduct, and bicarbonate is alkaline. So while lemon juice cannot alkalize your blood, it does produce an alkaline metabolic byproduct that your kidneys then process and excrete. This is why urine pH can shift after drinking lemon water, and why the alkalizing claim has enough of a biological foothold to keep circulating, even though it misrepresents where the alkalizing effect actually happens. Your blood stays precisely where it needs to be. Your kidneys handle the rest. The body's regulatory systems are doing their job the entire time, and they do not need the lemon water to intervene on their behalf. The liver detox claim follows the same pattern. Your liver detoxifies continuously, every minute of every day, regardless of what you drink in the morning. It does not require a trigger, and it does not store up toxins waiting for a signal to begin. The vitamin C in half a lemon, roughly 15 to 20 milligrams, is a small fraction of the recommended daily intake and is not arriving in quantities that meaningfully change your liver's function or mount a measurable immune response. Vitamin C at therapeutic levels matters for immune function. Vitamin C at the level of half a squeezed lemon is a contribution, not an intervention. This does not mean lemon water is doing nothing. It means the 3 mechanisms people most often cite for drinking it are not the 3 mechanisms that are actually working. Now here's the thing I mentioned at the beginning that almost nobody who drinks this every day has been told. Tooth enamel does not regenerate. Once the surface layer of your teeth is dissolved, it does not come back, and citric acid at a pH of around 2 is one of the more erosive substances your teeth encounter regularly. Picture the surface of your enamel as a tightly packed crystal lattice, the hardest substance in the human body. Acid does not shatter it. It dissolves it slowly, the way rain dissolves limestone over years, imperceptible on any given morning, measurable over 4 of them. Drinking lemon water through a straw bypasses most of the contact. Rinsing your mouth with plain water immediately after drinking it dilutes the acid before it has time to work on the enamel. Waiting 30 minutes before brushing your teeth matters, because brushing softened enamel wears it faster than acid alone. These are small adjustments with long-term consequences. And I see the dental erosion side of this habit in my department when patients come in with tooth sensitivity they cannot explain and a morning ritual they have never thought to mention. Elena was 51, healthy, thoughtful about her diet, and had been starting every morning with warm lemon water for almost 4 years. She came to me for something unrelated, and during the conversation, she mentioned persistent sensitivity in her front teeth that her dentist had not been able to fully explain. When I asked about her morning routine and she described the lemon water, we talked about the enamel question. She had been drinking it from a glass, swishing it around her mouth, and brushing her teeth immediately after, every step in the wrong direction. The sensitivity was not dramatic. It was early, and catching it early is the difference between a conversation and a procedure. So here's what warm lemon water actually does in the 10 minutes after you drink it, stated as plainly as I can. Number 1, it stimulates your digestive system through warmth and mild acidity. Number 2, it hydrates you after 8 hours without fluid, which matters regardless of how it happens. Number 3, it begins delivering citrate to your kidneys, which has genuine clinical support as a kidney stone inhibitor. Number 4, it does not alkalize your blood, detox your liver, or meaningfully boost your immune system at the quantities involved. Number 5, and it exposes your tooth enamel to acid that over years of daily contact without precaution can cause real damage that no morning habit is worth. Drink it if you enjoy it. Use a straw or rinse afterward. Do not brush immediately after. And the next time someone asks you why you drink it, you will be one of the very few people who can tell them what it is actually doing and what it is not. If this is the kind of clarity you have been looking for in a world full of wellness claims that sound convincing and fall apart under 3 minutes of honest scrutiny, subscribe. Most people drink this every morning for the wrong reasons and never hear the one reason that actually holds up. Now you have. I'm Dr. Miles. I'll see you in the next video.